Since 1990 to 2019, 20, something like that, there's been an 80% increase in cancer, okay, in young people. So I think it's obviously many different factors, but I always go back to in utero, what happened to you to where you are now? And I mean, lots of things have changed, okay? We didn't have lots of EMFs a long time ago, right? Before it's escalated and continuing to escalate. Our food supply is terrible. Glyphosate is in all the food supply and probably in over 95% of us. Incredible use of plastics. So much more pollution in the air, in the water, in the food supply. I mean, it's incredibly, toxic everywhere. It doesn't matter where you eat, what you eat, or anything, it's present.
Welcome to Take Back Your Health with Dr. Amy Myers. Today's guest is Dr. Leigh Erin Connealy, who is a leading figure in integrative medicine, known for her pioneering work at the Center for New Medicine and Cancer Center for Healing, the largest clinic of its kind in the U.S. She integrates conventional and non-toxic treatments, focusing on addressing the root cause of disease, including cancer. With 37 years of experience, Dr. Connealy emphasizes a holistic approach, incorporating nutrition, herbs, energy medicine, and advanced therapies to treat the whole person, mind, body, and spirit. Her influence extends globally, attracting patients and practitioners alike. Dr. Connealy is the author of two notable books, To Be Perfectly Healthy and The Cancer Revolution, and is currently working on her third book, to be released in 2025. Through her clinic, books, and educational outreach, she continues to inspire a new era of wellness and holistic health. Welcome, Dr. Connealy. It is so great to have you on Take Back Your Health. Well, welcome back to Take Back Your Health with Dr. Amy Myers. Today's guest is Dr. Leigh Erin Connealy, and I am very, very happy to have you on the podcast. I have been following you for quite some time, love all the information you're giving out, and have come out to see you personally. So it's just great to be able to have a chance to chat with you one-on-one and share your expertise with my community. So welcome.
It's great to be with you, Amy.
You are really well known, both in the conventional field and then integrative field for your work with cancer. And for our listeners that aren't familiar with you, could you tell us, really how you got into this work? I mean, you've been doing this for over 30 years, how you got here and your journey.
Years ago, I was born in the 50s and I was number 3 of 6 children. And my mother was pregnant with me and she started bleeding. And so the doctors gave her DES, diethylstilbestrol, to stop the bleeding and prevent miscarriage. And that was used for many years until, I think, 1971, where they found out that those children who were administered in utero had higher risk of cancer in both male and female offspring, hormone problems, anatomical problems, infertility, all kinds of things. And so, of course, they stopped using that drug in 1971. But when you go back into history now, they realize that that drug is a, class 1 carcinogen.
Mm-hmm.
And so I started going to MD Anderson because my parents received a letter and said, you took this drug, and so you need to go get evaluated. So when I was a teenager, I went to MD Anderson. And back then, it was, here you are, this spectacle, because you're like, okay, we got to look at these cases. And so here you are getting evaluated like by a dozen people, and you're getting pap smears, you're getting biopsies, you're getting all these testing. And so the worst thing I ever had was dysplasia. And so that forced me to okay, I got to learn how to never get cancer. So I went to college, went to medical school, went to training. And then when I first started my practice 38 years ago, I actually started with basically focusing on how you eat and how you live. And, weight loss was people's usually number one concern, just like it is today.
Right.
And so I hired a dietitian, a registered dietitian, to work with me. And so I started out that food is healing. And so I grew up in the South. My mother was a fanatic about what we ate, all the 6 kids. She nursed us, and then she fed us sauerkraut and bone broth and bone marrow and all the things that are fashionable today.
That's
So
great.
I was fortunate. Yeah. So I was fortunate to grow up very naturally. You never went to the doctor. You really never were sick. And so anyway, so then as things have gone through my life, it's interesting how your life kind of the right things fall in your path, right, to happen. And so, of course, I never had 2 periods in a row in my life. Of course, I couldn't have babies naturally, all these things. And then it forced me to really master the body in a way that you don't learn in a book, okay? And so because, of course, you can talk to other DES offspring and get info, but their journey is all a little different. And so I not only became a master of hormones because hormones rule your existence, and I had lots of hormonal changes and differences. And then I worked with this oncologist here in Orange County. And so he was really awesome. I mean, he was great. And I said, look, would you be interested in learning about integrative functional medicine? And we start treating cancer patients together. So we flew down to Oasis of Hope in Mexico. And Dr. Contreras, I met him at a conference, and he wanted to have a United States presence. So anyway, so we started Oasis of Hope here in California, the first one in the United States. And Dr. Fong, who's the oncologist, agreed to be a part of that and all that good stuff. So we started that. Then, of course, all the patients wanted to just be treated in California and not go to Mexico. So anyway, so they made a business decision to, keep their place in Mexico, and my clinic, stayed here. And so I had the opportunity to work with an oncologist, Dr. Contreras, who that clinic has been around for over 55 years now, something like that. And so, we started out with 1 patient and to where we are today. And so I devoured everybody's history, whether it's the Verson protocol, whether it's Dr. Gonzalez protocol, everybody, One Answer to Cancer, Dr. William Kelly, everyone. And then my last big mentor was a guy named Bill Curry. And Bill Curry had a sarcoma. And I met him at an A4M conference, which is a conference that doctors go to learn, right, a lot of things. So I was at his booth, and so he's telling me his whole life history, that sarcoma is a tumor of muscle and bone, and they wanted to amputate. And he was 22 years of age when he was diagnosed. And so he said, no, I'm not going to do that. So he spent the next dozen years on a discovery odyssey, traveling the world all over to see how he can cure himself of cancer. So I met him, and I'm like, I need to learn everything from him, what he knows. And so I really gleaned everything that he, knew from, there was so many things. And he was so passionate because he had, when people have something, they become so passionate about saving another person's life, just like you are. Okay. And then it's just been cultivating, I went to Germany and I worked and studied with Dr. Dow's, who ran the Bioenergetic clinic, is to learn about hyperthermia. And he was very well known. He was lecturing here in the United States. So he asked me to come, and I went and stayed there and lived at the hospital basically every day, went and saw patients with him. He just recently died like a year ago. So I've had the opportunity to look through different lenses of all these different people. And I still, I'm learning from my patients. They teach you things. And then, it's just a constant. Now, because cancer is 1 in 2 people, it's like everybody is, researching, because we can't continue on like this.
Yes.
And we can't. And fortunately for you, you've been so interested and passionate about your own health and really teaching people about prevention. And that's where we need to get. We need to go to a preventive, proactive, precise, personalized protocol. We need to eliminate the hormone interrupters that is going on in life today.
Right. I mean, there's so many directions we can go in here, but first I want to, thank you. And I witnessed it myself of you just, as you said, I'm constantly exploring and trying things, and I feel like I met my match, or you definitely exceeded me in terms of all of the things, the places you've gone, the things you've tried. I think we're very similar in that we never want to try anything with anybody else till we've tried it ourselves and can say, it works, it doesn't work, maybe there's something, but at least, there's no downside or whatnot.
Right.
The statistics of 1 and 2 with cancer, I mean, it's staggering. There's so many directions I want to go. So I guess the first is, when you and I were talking, you were saying it was about, I think 5 years ago, you really started seeing this uptick. And not only is there uptick, there is so many young people getting diagnosed with cancer. And the reason we met is I had brought my half-sister who was diagnosed with a pretty significant breast cancer at the age of 30, and she's 31 now. So I guess, can you talk to us about what you're seeing? And why is there more cancer, and why is it hitting so many more young people?
Right. Well, since 1990 to 2019, 20, something like that, there's been an 80% increase in cancer, in young people. So I think it's obviously many different factors, but I always go back to in utero, what happened to you to where you are now? And I mean, lots of things have changed, We didn't have lots of EMFs a long time ago, right? Before, it's escalated and continuing to escalate. Our food supply is terrible. Glyphosate is in all the food supply and probably in over 95% of us. Incredible use of plastics. So much more pollution in the air, in the water, in the food supply. I mean, it's incredibly, toxic everywhere. It doesn't matter where you eat, what you eat, or anything, it's present. Then if you look, people are way more inactive now. So they are sedentary. They're not moving and, utilizing their body. Probably maybe more alcohol intake, maybe, I don't know. So, I didn't drink when I was young, but that people, that's a common thing that happens from college on.
Mm-hmm.
And then the use of antibiotics. I think, I didn't grow up, we never took antibiotics.
Yeah, I didn't either.
But now, you go to the doctor and the doctor gives antibiotics for every condition. I had a brand new 26-year-old with peritoneal cancer. She had, since birth, she had taken antibiotics twice a year. So she's already had at least 52 dosages of antibiotics. So that destroys the microbiome. And then you already have the glyphosate and other things disturbing the microbiome. And that's houses 80% of your immune system. And then you have, obviously all the other toxic pollutants. So, and when you take excessive antibiotics, what do you risk growing is fungus.
Mm-hmm.
And so, and I just received a book a couple of days ago about the fungal etiology contributing to cancer. And this guy had cancer himself. He's from England. And so he was talking, and really, it's not the first person, because there's a very well-known doctor from Italy, and he has a website called cancerfungus.com. And he uses lots of baking soda intravenously, intratumorally, and everything. And then there's been many books. I know you probably read the book, The Yeast Connection, years and years ago. So, and then there's a whole TV show called Know the Cause, Doug Kaufman. He references every PubMed article about fungus causing this, that, and the other. So I think it is. And then when you look at the exposure of electromagnetic fields, the experiments show that EMFs make buds grow.
Mm-hmm.
And so we're just living in an environment we've never lived in before.
Yeah, when I was practicing, just to, compound on the candida or fungus aspect, whenever I would see people both with a low fecal IgA as well as, blood levels of low immunoglobulins, particularly IgA, being sent off to the oncologist in all kinds of places. And then I would uncover that it was candida or an overgrowth of fungus, you get rid of that, and then they're able to make their IgA. And IgA is our main source of immunoglobulins, which is essentially our immune system. So it's basically suppressing your immune system to where I guess it's turning off certain aspects of cancer surveillance.
Correct. And because everything is about your immune system. And in my next book, I talk extensively about the components of the immune system, because it's so interesting. Like, doctors are practicing oncology every single day. And as you know, there isn't a disease process that's not related to the immune system.
Mm-hmm.
And so they don't even assess it. They don't even tell patients, okay, well, we need to take this, this, and this to help your immune system while I do surgery, while I do chemo, while I do so forth and so on. And so, we need to really awaken people to like really how the body works. And that's what you're doing. And like, because I say self-care is the new healthcare.
Mm-hmm. So, I mean, let's dive into some things that we can do for prevention. And then I guess, I would say in the face of all of this, some good news is that there is new technology, there are new labs, things that are coming out that are enabling us to detect early. And so I'd love to dive into that. So let's first, I guess, get into what can people do now in the face of, all of this? Because I know it can feel daunting and overwhelming to people. So how can they, take control of their own health to help prevent cancer and frankly, any chronic disease? And then we'll dive into early detection.
Right. So health has to be everyone's number one value, right? Because everything hinges on your health, right? If you don't have health, you can't go buy it on Amazon. And it really starts with how you live your 24-hour day. And so when you look at the values, I think the first most important thing is our spiritual, emotional, mental state, okay? And we go through life because we live 95% in our subconscious. We're not conscious of how we're thinking, how we're living, and everything. And so I think that would be the number one thing we have to do to set our mind. Life is stressful, okay? There isn't a day that's not going to have stress. And then you're going to have extreme stress, like someone really important to you dying. Maybe you're going through a divorce. Maybe you lost a job. Maybe you lost a business. Maybe you lost an investment, all kinds of things, all right? And so those, you have to say, okay, how do I keep myself functional and stable? And do I need to go talk to someone? Whatever I need to do, but we have to really work on our spiritual, emotional, and mental state, because that directs the cells 24/7.
Mm-hmm.
Then we've got to sleep. 50% of the population isn't sleeping well. And sleep is when the magic happens. Your brain cleanses, all the organs go through detoxification. I mean, there's just a major reset when you go to sleep. And I know because I've had sleep disorder in my life before, so I know how that takes a toll on how your body works. Then, water today is not clean. So we have to have some kind of purification today. We used to drink out of the hose when we were growing up. I'm sure you did
me too.
Yeah. And so, but now you can't, you can't. The water is full of pharma water. It's full of toxicity. It's full of bugs. So you can't drink out of, the water or the shower, and it's got fluoride in it and chlorine and everything else. So we can't do that today. All right. And then we need to eat like our ancestors ate. We need to eat like an ancestral diet, a Paleolithic, basically fruits, vegetables, and protein.
Yeah.
Okay. Eating fake, processed, boxed food is just not going to heal our body. I tell people everything you eat is like a QR code to turn your cells on, to tell them what to do and how to take care of you.
Mm-hmm.
And your body is miraculously made. It's constantly trying to take care of you. No matter what you do, if you drink Diet Coke all day, it's constantly pulling and buffering detox systems to handle that Diet Coke until a point that it may not be able to do it. And so then people need to move the 800 muscles they have. And we are set into everything's automatic, robotic, and they want to put more robots in the world. But, we need to move. That's why they develop gyms. Growing up, there were no gyms, right? people went and walked and outside and, they did weights and stuff in their house, okay? They did push-ups, sit-ups. One of my patients, he's old, he says, I still do drain board push-ups. He's 90 years old. So that's the way you lived, okay? But now you have to go to the gym because we sit all day on computers. And then I think today, if we're going to live in this world, we've got to cleanse some way, okay? We've got to get sunshine. We've got to connect, go back to nature. We need to be connecting with nature on a regular basis, whether it's sitting on the grass, sunlight. They demonized sunlight, but sunlight is what we need every day to, all of our cells have light. And so we need sunlight. So we've gotten away, we've got fake lights, electromagnetic fields. We're living in this artificial environment, and civilization isn't working for us. If you look at the trends in health, every age group from birth to where we are now is sick, okay? And now our life expectancy is flatlined. It's flatlined now, but it's gone down really.
For our children.
It's for the third year in a row now, okay? So, and disease is just normalized now. No, that is not the normal way to live, is to be ill and sick and taking medications. And so we've got to awaken people. I think they just heard because, pharmaceuticals are on the TV. This is what's going to make you feel better. And everybody wants something quick, easy, fast. I tell people, I don't have anything quick, easy, fast. I'm 67, I've never seen it. I've never seen it in my life, quick, easy, fast. I would like quick, easy, fast.
Right.
But I've never seen it.
Right.
I'm telling you, I've never seen it. If you want to raise a child, do you do one thing? No, you do 1,000 things, okay? And so if you want to master, the 50 trillion cells and all the intricacies and relationships and the 100,000 chemical reactions that are taking place per second, it is something to be in awe of, okay? And if we taught people, if we started from the time a mother wanted to have a baby so she can get her receptacle in as good a place as possible, and then from birth, like in Japan, the obesity rate is less than 4%. In the United States, it's 60%, okay? But that is really what we're teaching them, right? And allowing them to have, correct? Because the 4-year-old doesn't go to the grocery store. And, I always use the analogy because one of my patients came in, she's a grandmother, and she was telling me, and, her daughter doesn't feed her daughter, the child properly. And I said, well, tell her that monkeys don't eat donuts, okay? And when, all the zoos around the world, they don't let their animals eat a diet that is available on every street corner in the fast foods, et cetera, because they wouldn't survive that long.
Right.
So how do you expect a baby child survive, on pizzas and, donuts? It's not going to work.
No.
And that's what we're seeing, because now I was reading, they okayed these drugs in children. I'm like, no, the complications are too astronomical to be putting children on these weight loss drugs.
I know. And it's simple. You just don't allow them that food and you let them be kids and run around, and then you don't have weight issues. I mean, right. I know, again, antibiotics and other things. And I certainly understand that there are people who, are on a fixed income and they, cannot afford the grass-fed or the pasture-raised or the organic chicken, but they don't need to be eating Fruit Loops, right? I mean, there is,
right.
The whole, which I appreciate everyone getting the word out, canceling Kellogg's, but it's my response to that is my child doesn't eat cereal. We eat eggs. Correct. And we eat, real food. Well, she actually intermittent fasts and doesn't have breakfast, but when she does, it's real food and she gets in her 3 meals. They're just more compact. She, just naturally doesn't like breakfast. But it's not, and if on a rare occasion when we're in Austin, there's a great gluten-free donut place, it's you're eating some protein before I go get you a donut. And that's exactly a rare occasion when we're, in Austin or on a trip or something. That's not something that's happening daily. Well, I think we can all agree that prevention is key. I mean, hopefully everybody listening, if you haven't, 1 and 2, I know 25 years ago, I just passed the 25-year anniversary of my mother being diagnosed with pancreatic cancer and passing away in 4 months. And, at the time, I knew no one with cancer.
And I didn't know what a metastasis was. No one in my family has, on that side of my family, has since gotten cancer. And so now it just seems like almost daily I'm getting a text or a call from somebody with, that I went to high school with, or their parents or somebody, having cancer. So prevention's key, but I think the next step is early detection, right? I mean, unfortunately, and you can speak to this better, so much of what is happening with people is that they're also getting diagnosed late, right? And you have less chance when it's already stage 4 or stage 3. And if you're catching something in a micro stage or stage 1 or 2 or stage 0, your odds, again, you can speak more to this, I imagine, depending on the cancer, are just so much better when you're, seeing someone at that stage. So can we talk about, what you're utilizing in your clinic, what you've seen, as early detection? And I know that those things can differ based on what type of cancer you're looking for, but if there's any kind of broad sweeps or cancers that you're seeing mostly, like breast, things that you can do for early detection.
Right. So that's a great question. It's interesting that you bring this up because yesterday my first patient was a 32-year-old with breast cancer from Canada. And she was part of a study because she has a CHEK2 mutation. She inherited this, particular genetic mutation that predisposes her to cancer. So they did, she's been doing since 2018, she has been doing whole body MRIs, dedicated breast MRIs, endoscopy, and colonoscopy.
Wow.
And she had all of that done in 2023 and now has stage 4, breast cancer. So I was like, because, people ask me all the time, Amy, about these whole body MRIs, okay? Well, once you see it on an MRI, it's already 8 to 10 years old. So we need to be focusing on before 8 years, all the 7 years of opportunity to prevent cancer, okay? And and yesterday was like a glaring example of how extreme early detection in the conventional world, and was, because she's I have 2 patients from Canada. One was doing it for another reason too, and did get diagnosed with breast cancer. And I don't know if it's just the mental thinking, sometimes I think it's sometimes like, okay, my mom had it, so then we're going to have it. But, genetics, it plays probably less than 1% in cancer. So genetics is really not the problem. And it's the exposome epigenetics, right? But that was okay, she did everything, okay, properly. So how I do it in my practice, the people who come to me for prevention. So those are people that are just coming in to get optimized.
And let's just clarify for people, you have the Center for New Medicine, which is the preventative arm, and that's where I came and saw you. And then you have the Cancer Center for Healing, which is, you have been diagnosed with cancer, and that was the side that my sister was on. So just for clarity, that you have, two sides of your practice.
Right. Yeah. So we have, just like she said, Center for New Medicine, you want to prevent it and or chronic diseases, but the cancer side is strictly for the cancer patients.
Okay.
And so we have patients coming on the Center for New Medicine. They just want to make sure they don't have cancer, because a lot of people today are, because it's a 1 degree of separation, they have many friends with cancer.
Yeah.
So now it's becoming a glaring problem for everyone. And so now everybody's kind of a little bit more paranoid, but doctors, our conventional medical system for any disease is not about prevention.
No.
Okay.
Absolutely.
Not in any way. I know there's probably functional medicine doctors who are on the preventive arm of helping patients, but the conventional is they are taught what to think, not how to think. And they are taught to use a drug or surgery or both, or a smart drug. So that's what you're offered. You're not taught, like even in the cancer realm, the cancer patients aren't really taught how to never get cancer again. Once they get it and they're clean, the doctor says, well, you're going to be telling me when your cancer comes back because you're going to have a pain. And I'm like, that's not how you want to, that means we're not doing, as physicians, we're not doing our job.
Right.
Okay.
So tell us how you're helping people, prevent and then do early screening.
Detection. Yeah. So how I do it and how I have been doing it for about 25 years is I developed a screening blood test that I talk about in my book, Cancer Revolution. So some of the most glaring things that are important in prevention of cancer, but it's not a slam dunk because I tell people blood work typically doesn't tell you have cancer, okay? But there are some markers that tell me there's things wrong. And one of them is the C-reactive protein. So that's a nonspecific marker for inflammation. So if you have a level over 0.5, we know that there's an issue. So inflammation is the precursor to all diseases. Your vitamin D, it influences over 3,000 genes. So it either downregulates or upregulates. So we know, and most people unfortunately have low vitamin D. Then if you look at your hemoglobin A1C, which is a reflection of your sugar and or aging over the past 90 days. So if that is elevated, then that means your body can't take care of itself as efficiently as when the hemoglobin A1C is less. I always tell people hemoglobin A1C is a reflection of sugar, but it's also a reflection of cross-linking or wrinkles inside your body. And so those three things. Now, there's another blood test called Nagalase. Nagalase is an enzyme that prevents the macrophages from attacking the cancer. So that's part of your immune system. Like you were just talking about secretory IgA, which is an immunoglobulin. So there's things that we can do. We can do immune testing, like a T lymphocyte panel to look at your immune system, natural killer cells, T cells, B cells. Now, I don't do that on every single person. Maybe if you've had the vaccine, I will do it because I've seen some of the studies that it can compromise. So I think that I make a decision on that. Then you got to check people's hormones. If you're low thyroid, you're higher risk for cancer. If the DHEA sulfate is low, your people with lower DHEA have higher risk of cancer. So there is a blood test called the Cancer Profile. Now, I don't know how long they're going to be in business because there is a blood test that they do called PHI, and that's a blood test, and they're having difficult time getting the reagent. So that's an indication of anaerobic without oxygen environment. So I think I've been using it for at least a dozen, maybe or more years, and it's an amazing because we know that cancer is an anaerobic acidic environment. So it was a great tool. So I'm still looking, and they're trying to find someone to buy the lab. Now, the other thing is there are liquid biopsies, okay? So liquid biopsies are, you draw your blood and you're looking for cancer by looking at circulating tumor cells. So there's several labs. In the United States, there is no lab that does that, okay? So the labs that I have used over the years are Main Track out of Europe. I have used RGCC out of Switzerland and Greece, and Datar. And so those are the main labs. Now, there's 5 articles a day on PubMed on circulating tumor cells. So the science is getting better and better. But in the U.S., unfortunately, we don't have any great labs. And I always tell people, it's just another tool. The other tool that I have is the bioenergetic testing. So the mentor I was talking about earlier, he went to China, and because they were all lecturing at an integrative oncology conference, and he met this Dr. Wang, who's still alive. He's in his 70s, and he's like a savant. And they've been utilizing herbs for cancer for over 400 years. And so he taught him a way of, in Chinese medicine, there's 8 systems in the body. You have the pulmonary, the gastrointestinal, the genitourinary, the glands, the blood, the lymph, muscle, skin, and bone, and central nervous system. And so the arena for cancer is what? Immune system compromise, acidity, angiogenesis, the ability to make blood vessels, toxins, and let's see what else. That's the main things, okay? And bugs, viruses, bacteria, fungi, and parasites. So when you have acupuncture points all over your body, so we take the top 50 points, and each point is related to an organ or gland in your body. So if you don't have energy or chi, then it can't take care of you. So if there's something blocking it, is it heavy metals? Is it toxins? Is it stress? What is it? Okay. And so we check all the needs of all of those things that I just talked about, acidity and toxins and bugs, et cetera. And then it's all about the tumor microenvironment. But what makes an abnormal tumor microenvironment, okay, is, you have the mitochondria. The mitochondria are the powerhouse engines of our cells. They're constantly being attacked and bombarded by chemicals, bugs, stress, heavy metals, everything, okay? And so the mitochondria make your currency of life, ATP. And so the more that it's bombarded, the less energy it can make for you. And it turns into what we call an anaerobic without oxygen environment. And then when you have hypoxia or low oxygen, you automatically make acidity. And so your body is constantly trying to buffer, but sometimes it's just too much on board that it can't handle the constant acidity. And so then you have the fermentative environment for the cancer, for one abnormal cell to turn into cancer. And so then this propagates, and then you have a tumor.
And, the very interesting thing is, and correct me if I'm wrong, but I'm really glad you brought up the tumor microenvironment. I mean, when we're talking about conventional oncology, they are not doing anything to change this microenvironment. So they're just trying to kill the tumor and, remove it and then kill the cancer cells. And so, isn't this a reason that many people have a recurrence? And then to compound all that, much of what they're doing with high-dose chemotherapy and other agents, giving steroids and things like that, they're creating a further acidic environment. And then all the steroids can help, the yeast overgrow. And then it's almost like everything that they're trying to do to get rid of the cancer is everything that I would think someone like yourself is working so hard to actually undo.
Yeah, it's accelerating the tumor microenvironment. You are absolutely right. And it's so funny because all these articles are on PubMed. And so when I see a patient and, okay, first of all, just getting a biopsy is an inflammatory, injurious, immunosuppressive process, right? Okay. And then you do the surgery, okay, you go under anesthesia, you get antibiotics, it's a very, very serious process. That's why we always do this, preventive protocol before even someone has surgery. And then you add chemotherapy, which is extremely toxic. And we have to take care of the cells, the individual cells that are undergoing the chemotherapy. So conventionally, they just give you the chemotherapy. Okay, we'll see you in a week, 2 weeks, 3 weeks, whatever, depending on what your regime is. And so then it also makes that circulating tumor cell more rabid also, because they get very, very angry with the chemo, the radiation, and all the things. And you mentioned steroids. Yesterday I had a patient with esophageal, and she's on, this high dose steroids. Well, what are you doing? You're increasing your sugar. We know that elevated cortisol without steroids accelerates inflammation and metastasis. So we need to be getting the microscope out with every single patient. We've got to, like I said, this takes 8 to 10 years. That means we have opportunity to prevent cancer and create health. That's what we should be doing. And if someone comes in with the disease, our goal is, how do we create health in you? And you're not going to do it in a day or two. It's going to take several months to get your body in homeostasis. So our medical system, as you know, it's reached its point of no return. I think it's great. The blood testing we have, the scanning we have, I think those are great. We have some phenomenal things if you're in an emergency, but for management of chronic disease, we're failing abysmally. I was reading a couple of weeks ago that we rank 69th in the world in healthcare.
Yeah, we spend the most, I believe.
And exactly. We spend 2.5 times more than any other country. So we need to take a look. We need to stop doing what we're doing. Doctors have got to learn conventional with the new, what I call updated medicine.
Yeah, I mean, for me, it's like, because some of these lab tests that check for the circulating tumor cells, I've done them on myself. I'm somewhat familiar with them. Several of them give you conventional chemotherapies that are effective against the tumor and the CTCs, as well as, medications, repurposed medications, as well as natural agents. And I was just saying, instead of viewing this, because this is, happening with my sister, it's like she has this oncologist and then she has, integrative doctors. And it's like there's this divide. And somebody should say, here is this test and here are all the things that work. So like, hey, why don't we try a month with these chemos? And then next month we'll try, curcumin or these natural agents. And then we'll add in an aspirin or whatever is on these tests shown to be effective. And everybody should be vested in, we're going to save this person and get rid of this cancer. But as you know, conventional medicine has a very different business model regarding, chemotherapy. And, it's kind of big business. It's a $1 trillion business. And just for clarity, for those listeners that don't know, you do use some low dose chemo in your practice. So for people, we're not saying that you're opposed to this. There is, and you can speak to this, a place where chemo is something that you may want to be doing.
Well, right. So the conventional things that we need to do. So if somebody has a lump or bump, imaging does not tell if it's abnormal. So the gold standard is to do a biopsy, okay? And the biopsy is going to determine what kind of cancer it is and the markers of the cancer. So, of course, that's conventional. Then, of course, patients need to have surgery. They need to take it out. If it's a breast lump, of course. Now, I have patients who truly desire just to monitor it. And if they choose to do that, then I tell them, okay, we're going to do this, this, and this, and I will be checking you every 3 months. And so if they decide to do that, they have sovereignty over their body, and I have to honor their request. But surgery is necessary, okay? If you've got a big mass in your colon, it's going to have to come out. And if you have a breast lump, it's going to have to come out. Now, prostate is more of that. If you're diagnosed with prostate, that's like the most reasonable cancer to deal with. And it's usually just monitoring most of the time, not all the time. But in conventional medicine, that is the dogma. But as long as it's not a young person that's being diagnosed with prostate, if you're older getting diagnosed, it's like, we'll just do vigilance, okay? But first of all, we should be saying, no, let's create health. If you have this known situation, let's do everything to create health. So maybe this prostate lesion can go away. Instead of just watching the PSA grow and the MRI get worse, why aren't we saying, well, let's see what we can do to keep this and maybe coexist with cancer? Patients today can coexist with cancer. And then chemotherapy. Of course, if you've got cancer that has metastasized, which means has gone outside of its original location, we're going to have to shrink it with conventional chemotherapy or low-dose chemotherapy. Low-dose chemotherapy has been around for about 70, 80 years. It's not something new. It's using chemotherapy at a lower rate, 10%, 20%, 30%, depending on the situation. And you use insulin because cancer cells have insulin-like growth factors on them. And so then we bring your blood sugar down to the therapeutic moment, and then we get the chemo because the cancer is ready to take in the chemo, saving the rest of the cells and preserving the rest of the body.
Now, sorry, real quick, can you achieve that on a ketogenic diet by itself, or do you really need the insulin to do that?
Well, yes, because you're bringing it down to a blood sugar level of 40. So that's considered the therapeutic moment.
Okay.
Yes. Now, can people, I don't know, like I don't know if they can get it down with these continuous glucose monitoring. It'd be interesting to see if anyone brought it down to like a therapeutic moment on the keto or fasting or other methodologies. So, but typically we have to do the insulin to stimulate the insulin-like growth factor so they're hungry for the chemo.
Mm-hmm. So the cancer cell is hungry for the chemo.
Yeah.
And I know we want to stay clear of vaccines, but just backing up to lab testing and papers, I don't know if you've seen, it's a very recent paper. I just discovered it myself, but it was actually about IgG4 levels and an increase in those who had received a second COVID vaccine or a booster going up 39-fold that was not seen in folks that had not been vaccinated but had had COVID 1 or 2 times. And the aspect of this was that by having these elevated IgG4 levels, it suppresses your GALT mechanism, which is your surveillance mechanism for cancer. And so the whole paper is a hypothesis of, at least as of recent years, why we might be seeing more cancer is that this surveillance mechanism is getting shut off. Have you seen this paper or started checking IgG levels at all?
No, I haven't. I've been checking spike protein because that also is something that's going to be interfering. And now, of course, every day new studies coming out for all different things every single day. And it's just like DES. DES was used for 40 years. And then, of course, now they have a whole list. So, I always say that COVID vaccines like the DES, discovery. And so, I mean, it's so new. We don't know what all the ramifications are. That's why I check their immune system, because we don't know what is really happening. I mean, I was listening to a gastroenterologist. You probably have heard of her. And she's finding that it wipes out the lactobacillus bacteria. So, I think there's so many things to look at now with something that's novel.
Right.
And so we all need to be paying attention, stay astute, be open to every discovery that's being made. And like you said earlier, all doctors should be cooperative and collaborative for the optimal outcome of the patient.
Yeah.
And I find that, like I saw a report of a doctor oncologist saying that, well, I don't think vitamin C works. No, we don't approve of vitamin C in mistletoe. And I'm like, well, okay, mistletoe's been around for over 100 years. The efficacy of vitamin C, I mean, the University of Kansas is doing like all the studies on IV vitamin C. I mean, they're better outcomes, everything. So I'm like, well, why don't we just read and explore? And why don't we just see how better outcomes people have? I know here when our patients, we have patients do conventional with all the treatments that we do here. And then we have patients that do chemotherapy here, the low dose, and all the treatments. But these patients are functional. And they are able to live their life, and they're able to stay strong and vital while they undergo treatment. And that should be our goal for any disease process.
Absolutely. So along those lines, what are things, let's just say you just got diagnosed with cancer and maybe somebody is opting to do the conventional route. What are maybe the top 3 to 5 things that you would recommend? Vitamin C, hyperbarics. What are the things that you would recommend to help somebody get through that fasting, ketogenic diet? If you have
all those things. Yeah, really optimize their 24-hour day with sleep, water, the right foods, get off processed foods, get on a clean diet. Fasting we know is incredibly helpful in autophagy and clean up the cells. I mean, I've had patients get rid of tumors just doing fasting or decrease it by 50%. So it's very difficult to fast. You can do 1-day fast, 3-day fast, whatever you think you can do, would be good. Your daughter's doing a different kind of, like a little modified fasting. So any kind of fasting we know is very, very beneficial to the body. Exercise, sunlight, and then you mentioned vitamin C. I would say
top thing would be vitamin C, IV vitamin C, not just oral, but IV vitamin C. Hyperbarics or ozone. I would like ozone because ozone neutralizes toxins, helps your immune system oxygenate, and kills bugs. So that is something I would do. And I think Baden-Baden Medicine Week last in October, they are using repurposed drugs with ozone with everything else. So I use a lot of repurposed drugs. I tell people, you cannot rely on one path of healing. You've got to get as many paths of healing as possible, especially in this day and time with the outcomes that we're seeing today. So cleansing, I mean, any kind of cleansing, infrared sauna, baths, you got to get all the junk out. I think using antifungals, either natural and or medications, antiparasitic medications, those are usually very compatible with everything that a patient is doing. And doing emotional attunement, making sure that you're managing your stress, or if you've had unresolved emotional stress, make sure that is transformed into a positive frequency in your body. And I find people have, if you really delve into, they have a lot of stress that they haven't dealt with, you know? And because we're taught to muscle through things instead of saying, okay, this is what's happening. I got to turn this into good, no matter what it is.
Yeah. Yeah. I mean, trauma's a whole nother conversation for sure.
Well, right. And anything that stimulates the energy, just grounding, you know, is an amazing free resource to do every day to get those electrons in your body. Okay. Now, the mechanical ways are the pulsed electromagnetic field. Now, I use a lot of light therapies too. So sun ray, but I also do light therapies with my IVs. So, you know, obviously the more the better, because I always tell people we're making up for lost time. Okay. And so if you're stage 1 or 2, we can turn everything around in a year. And then if it's stage 3 and 4, it may take 2 years. But you can't just chemotherapy. There's not 100% slam dunk, okay, with surgery, chemo, radiation, okay? Because cells have chemo resistance and chemosensitivity. Radiation, same thing, radiation sensitivity, radiation resistance, okay? So, and surgery, what about microscopic cells? I was just reading a report. They use a drug called ketorolac. That's an antifungal, but it's very good for, you know, killing cancer. Now, it's not an easy drug on the system, but they were talking about how it had more effective when you added that. So usually I use other things. I use Tagamet, I use modified citrus pectin, I use all these things, whether you do a biopsy or you do surgery. And then chemotherapy, I always put patients on protective protocols, something for their immune system, something for their nutrition, something for their liver, because their liver is going, you know, you're having all these things. You can do liver flushes or coffee enemas. So and then vitamin C oral and IV vitamin C. So there's some things you really need to do while you go through a surgery, a chemo, or radiation.
And you have a book, and you know, is all of this mentioned in your book?
Yes, it is.
Okay.
It's all mentioned in my book, Cancer Revolution. In fact, I just finished my second book that's coming out in 2025.
Oh, great. Okay. Is that the notes here said that was a revamp. Is that a revamp of the original book, or is this an updated version, or is this a separate book?
It's a separate book because it's going to be talking about things that haven't been talked about.
Okay. Yeah. Well, and there's been a lot already. Well, one of the things I quickly want to talk about, because I know you have to head off to patients, is QT scan. This is something that you have available in your office. There are very few of them in the country. Can you quickly tell us women about QT scan, why this is a better alternative to a mammogram? And, you know, can people who are not patients of your clinic come in and get one of these, you know, routinely?
Right. So QT was developed by a physician, Dr. John Clark, who's almost 80 now. And he developed a kinder way of evaluating the breast, especially for women less than 40, because there's no real good screening for women less than 40 because they have very dense breast. So the it's called quantitative transmission QT. And it is an incredible thing. You put each breast in water and it runs sound waves through it. And at this point in time, it is not a replacement
for mammogram, ultrasound, or MRI. It's an additive evaluation, especially I feel like in young people. And so, when we look at imaging, and I would say that when people get mammograms, we miss 50% of pathology. So it's just not enough. And this quantitative transmission has a resolution 40 times of MRI. And the problem with MRIs, we're using gadolinium, which is toxic to the body. And I always detox my patients from the gadolinium. And so we've got to have other ways of looking at the breast, because breast cancer is 1 in 7 women. So we need to have the best tools possible. And QT now, it's FDA approved now. It's being basically all over the United States now, being launched. Okay, like Dr. Meyer says, there's only a few now on the East Coast and here in California, but it is a new, kinder, gentler way of getting your breast assessed.
So what, do you recommend that in thermogram? Do you recommend that in like a Pronova? What is, are you recommending
that's a good
MRI?
question. Yeah, I like that. I like the QT with thermogram, because thermogram I've used for so many years, and I have found it's very incredible about showing vascularity. So we know that cancer are vascular through angiogenesis. So because the breasts are not vascular. So I like the QT with the physical exam, QT, and thermography is the best way. Because if you really want to know the truth, most women find their own breast cancer.
Yeah. Well,
That's the number way is diagnosed.
Yes, so breast exams. So I know that you need to run. I always like to ask my guests 3 ways that you would encourage our listeners to take back their health.
Get educated. Spend all your free time learning, listening to podcasts, reading books, being open to every single thing. Reading as much. There's so many things on Substack it's free education. And then really take a moment to examine your own life. I know with talking and really getting to know Dr. Myers, she is really taking a deep dive. And I think we all have to take a deep dive at looking at ourselves and being mindful and really asking the people who truly love us, what are the things they think that they could improve in their life? Because we should all want each other to be the best version of ourselves.
Awesome. That's great. Nobody has said that yet. So I appreciate that. Well, I thank you so much for everything that you do for the world and for those trying to prevent and reverse their cancer. So it's quite the feat, I know, to have a clinic, do all the social media, educate, and you are doing it all. So thank you so much.
Well, thank you for partnering with me and making the world known that we can transform the future of health and humanity together.
Awesome. Well, thank you so much. It was great to see you, and we'll catch up again soon.
I want to thank this week's guests for sharing their time and knowledge, and thank you for listening. To read the full show notes for each episode, which include a summary, timestamp, quotes, and any resources mentioned, please visit amymyersmd.com/podcast. Lastly, if you've enjoyed this episode, I'd love if you would leave a rating and a review on Apple or Spotify, and we'll select a few to read out loud in a future episode. Tune in next week to hear from another inspiring guest as we help you take back your health.